I'd like to begin the meeting on October 27th, 2020, 5:01 p.m. All board members are present, as well as Kristen Kennedy and Tim Myers. And tonight's, I have to read that thing. In keeping with the ongoing emergency order from Governor Charlie Baker to limit gatherings and maximize in keeping with social distancing and under legislation passed to address remote board meetings during the emergency declaration, this meeting will be conducted over Zoom. Attendance by board commission members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on ECAT. To join a remote meeting using your computer, click the URL at the top of the meeting agenda. And tonight's meeting is about an update on the novel coronavirus. Kristen?
Okay. So I'm going to attempt to switch over to screen share, and
You're on a roll.
well, let's see, we're on a technology roll today. Okay, now, this is the only part I forget how to do, how to get it to full screen. View.
Is there a little box down at the bottom right corner? All the way, that one?
That one. Nope.
Nope. Okay.
I think you just go to slideshow and just hit start slideshow.
That would probably work too. From the beginning. All right, let's go with that. Here we go. All right, so as Lynn mentioned, we are here tonight and I am ready to give you an update as to what is going on and is new as far as COVID-19. So I had presented this slide a month ago when we had this COVID related meeting, and I've updated it for today. So as of today, we have 384 cases of COVID since March 12th. I believe when I spoke to you and presented this presentation a month ago, we were at 350. So in the past month, we have added 34 cases. We have 18 confirmed cases between Sunday, October 11th and Saturday, October 24th. That's the date range that will be used to calculate our color coding status in the report that will come out. They've shifted it now. I don't know if anybody noticed, they're no longer putting out the report on Wednesday evening. They're updating the dashboard, but they're not releasing the color coded report until the Thursday. Although they're still pulling the data on Wednesday, they're taking one more day to refine it and get the whole document together. This could change. They will pull data tomorrow morning. And when I say this could change, it could change for a few different reasons. We could have somebody who's was tested on Saturday the 24th whose test results aren't in. That could add, because the positives are reported out on the day that the test was done, not the day that they're resulted. Makes sense. So we could have some numbers still added to this. I don't think we would have any cases in ours that would be being transferred over to another town. That can happen where something might initially report as Easton, and then through the case investigation, we find out that the person is moved. I don't anticipate any of ours. I believe all of ours have been contacted. Don't anticipate any of ours moving out of our workflow, but consequently, we could have people identified that, again, move into ours and go back as far as the 11th. So these could change. But based on the information that I have in front of me today, it is likely that when the report is released on Thursday, we will creep from green up to yellow. Over the past 2 weeks, we've had 9 cases in each week. Some of these are reflective of what is largely being seen across the state, in that clusters are affecting households. And they're the biggest, other than the nursing homes, one of the other bigger cluster components that they're finding when they chart out at the state level where they're seeing pockets are within households. The virus does spread very easily, especially when people are in close contact and when their guard is down. The last time I presented this slide to you guys, I gave you data broken down by age. I've given you that again, except this time I've done it week to week. So the week ending the 10th, and when the state looks at data, they're always looking at Sunday, the start date, and Saturday being the end. So basically how we look at the calendar, Sunday to Saturday. So as you can see, we have last week, the week before last, and the week ending the 17th, you can see that the numbers under 18 were actually pretty significant and pretty average in that age group. But you can also see what I've been talking about in that the age group of that 18 to 29-year-old group is making up a large number of our cases. And that's, spiked again in this last week, ending the 24th, with a total of 4 cases that fell into that age group. The interesting thing is that we are not seeing as many cases in our older population. I think that's partly because they are still being very, very careful. They have not let their guard down. And what we're seeing in the dispersal across these younger age ranges are people letting their guard down, attending gatherings, and not being as diligent with some of the ways that we know we can protect ourselves. So ongoing prevention efforts from the town side. Town hall does remain closed to the general public, except that right now we're doing the early voting. They are using a health screening. They're limiting contact. They're limiting the number of people that are allowed in the building. The town is, as I mentioned before, offering limited in-person services via appointments. There does not seem to have been a very high demand. There are so many things that we have become adept at doing remotely that there really is not a big need. One of the big things that we did as a department is we established a board of health at easton.ma.us email, which has really circulated quickly through our real estate agents, our contractors, and is now one of the main ways that people request documents. And it's very quick and very easy. The email is seen by myself as well as Tim and Mark, our 2 inspectors. And requests for copies of what's in the file are generally filled within a matter of hours, without any type of interaction, in its electronic file. If somebody actually really needs a paper piece, we are arranging to meet people in the parking lot and turn over those documents. The Easton Emergency Management Association executive team does continue to meet twice a week. We provide departmental updates. We check in with each other and plan for upcoming challenges and share information. And the Easton Public Schools Administration, along with myself and the public health nurse, continue to have daily check-ins to review cases, to review questions, and to make sure that we have a good handle on what is going on in the schools. So some questions have come up in the past couple of weeks, and I thought this one, so I guess I was going to save this towards the end, but one of the new additions that I don't have a slide for, but that I did want to mention is, I know I've said we were bringing some interns on board. It's official. We have 2 interns that are working with us now. And one of them is actually handling some of the handling all of the check-ins with a group of contacts that we have. It's going very smoothly. She's doing a great job, and it's allowing us to keep a lot of our cases local, as opposed to sending them out to CTC. While CTC is a great resource, some of our cases, some of our contacts that need to be followed, we feel really need a little bit closer and a little more homegrown approach. So this internship situation is allowing us to provide those extra supports. And in training the intern for some of the discussions that she was going to be having, this idea came up as to why people are getting tested. And I thought it made sense to kind of review it in this format as well. So we all know people get tested because they're symptomatic. People have symptoms relative to COVID. You tell your doctor, you make an appointment, you go and you get tested. It's either COVID or it's not COVID. People who are identified as contacts to positive cases. The current recommendation from the state is that they go and get tested. The test does allow us to identify especially asymptomatic people. The test does not affect or impact their quarantine. If somebody is identified as a contact, they do need to observe the 14-day quarantine. The testing in the middle gives us a chance to find out, or a few days in, gives us a good indicator as to whether or not they actually are going to develop COVID, gives us a chance to identify those asymptomatic people who then might be spreading it within their house. Other reasons that people get tested: travel. So individuals who are traveling to Massachusetts can test up to 72 hours before they arrive, or anytime after they arrive, they can get a test and they can exit their quarantine when and if the test comes back negative. They're still required to quarantine if they don't come into the state with that magic ticket that says they're negative until they get those negative results. Individuals may test to meet their destination requirements. Other states have different requirements and might require us to, as well, you guys as residents of Massachusetts, to have a test before you go to New Hampshire or Maine or Hawaii. So people are testing for those. We're also running into, and what a lot of people who have been fortunate not to have to undergo a medical procedure in the past 6 months, is that individuals are now being tested prior to undergoing medical procedures. I had a friend need to have her meniscus done 2 days before the operation. She had to go get a COVID test and then agree to quarantine and not expose herself unnecessarily so that she could have her surgery. We have individuals who are testing prior to gatherings with non-household members. That same friend has a beach house, and her daughter had college roommates, and they all wanted to come visit, and they all had been being very careful. And as a group, they all decided that what they would do is the girls would all get tested before they came down and quarantine before they got there, in between their test and arriving, so that when they did get together as a group, they didn't really have to have that on their minds. They could relax. They could not have their guard up and could actually enjoy their visit. We've heard of this and been told about this pertaining to weddings, small family gatherings, visitations that are occurring. We also have people that just go and get tested because they're curious. I don't know. I'm not too curious. I've been tested once. It's not a feeling I want to have to repeat. I'm not that curious that I want to go have my brain tickled again. But there are people that are out there that are curious, that just are wondering if they might be a positive case, and the format is there for them to go ahead and get tested. So that kind of leads me, as I mentioned, gatherings and whatnot. So we are coming up on holidays. We have Halloween at the end of this week. We have some new information that was posted by the state on Thanksgiving gatherings. CDC has a great kind of go-to page that goes through a lot of the holidays, but a lot of the advice is the same. As far as from a national level and from what CDC is saying, gatherings and what we're seeing, as I said, with the contact tracing and the identification of clusters, is that gatherings do really seem to be, I hate to use the term super spreader, but they do tend to present an environment where the vaccine is spreading. And they think this is because when people get together, they lower their guard. They, are with people that aren't in their normal household, and they lower their guard. They get closer to people than they normally would be. They stop wearing their masks. They share food and drink and utensils. And again, then they're eating together with people they don't typically eat with. They participate in self-service food where somebody may be coughing or sneezing or breathing where there is food. They sit closer together. You sit at a picnic table with somebody. It's not like having somebody dine at a table in a restaurant 6 feet away from you. You're dining with people that you don't typically dine with. They hug. We shake hands. We sing. We dance. We shout. We call across rooms. We do all of these things that, for an asymptomatic positive person, can contribute to the spreading, which increases all of our chances of catching COVID through the air, through this yelling and singing and dancing and all things that we all are so desperate to want to enjoy, but that we have to acknowledge present a higher risk and prevent an opportune environment for COVID to spread. So as we go into the holidays, as much as everybody wants to be together, we want to remind everybody that Massachusetts does have gathering size orders in effect from the governor. We are limited to a maximum of 25 people indoors for all communities, but that itself is higher than what most of us should be thinking about. My immediate family is about 25 if we were to sit down and have Thanksgiving together. But that would mean being indoors with 25 people representing upwards of 7 households, representing 3 different states. It's not wise. It's just not the right environment and not the time. The state's website, and they've just posted, as I said, some new Thanksgiving guidelines, much like the Halloween ones, does give some lower risk alternatives. Dining with your household, trading recipes instead of sharing common food. If people do insist on gathering and getting together for the holidays, there are some hints for some of these higher risk gatherings that involve things like having one person prepare all of the food, designating one person as the server. And this allows only one person to contact the utensils. Having one person act as server even with the condiments, or portioning out the condiments ahead of time so that there isn't that sharing and touching and people are able to spread out and not be reaching across each other in dining rooms and at tables. Our outdoor gathering remains at 50 if it's in a private backyard. And again, those outdoor gatherings with 50 people, there's singing, there's shouting, there's a lot of things that people just need to be aware of and be conscious of. I know the temptation is to not wear your mask when you're with, the people that you have socialized with in the past and had, larger fire pits with. But if they're not part of your immediate household, as we move indoors, we do need to be conscious of the number of asymptomatic people that are walking around that could potentially be in these groups and could be spreading COVID-19. With that in mind, I'm going to take another opportunity to talk about the flu vaccine because of the pandemic. Anything we can do to reduce the spread of any respiratory illness is as important as ever, if not more important. We have in Massachusetts a new vaccine requirement that's an important step in reducing flu-related illnesses and the overall impact of respiratory illnesses during the pandemic. That is that now flu vaccine is required for all Massachusetts school students if they're in childcare, pre-K, K through 12, or post-secondary. To that end, we have arranged for CVS to help us, and starting tomorrow, we will be having the first of 2 clinics aimed at our school-age children and their families. So October 28th and November 4th, Frothingham Hall from 1 to 5. There is a link on our webpage where people can pre-register. You can pre-fill out the forms when you arrive. CVS will have them all printed. They'll go through some questions that really can't be answered until the day of. You sign and you're in and out. We did, last week we did town staff. It went extremely smooth. And I encourage anyone who is in need of this vaccine for themselves or their children to go ahead and pre-register. Don't worry so much about getting everybody the exact same time. You can all come together and they will process you together as a family unit. It is important that you register, and they may have closed out registration for tomorrow in an attempt to account for the number of vaccines. But there will be a certain number, a small portion of, they factor in for a small portion of walk-ins. What we saw last week was higher numbers in the before like 3 o'clock, and then it kind of died off. So I don't know what to expect, but I know our health agent, Mark Taylor, will be there to help direct traffic within Frothingham Hall. You'll enter through the first door, proceed into the big hall where CVS will process you, and then out the front door. We also have scheduled them to come back on November the 18th. Same place, same time frame for all residents ages 3 and up. And there will be high dose vaccine available for those over 65 years of age. So this is a great opportunity to get your flu shot, get it all as a family, not have to worry about doctors and co-pays. There is no charge for this right now under the CARES Act. We feel that we are going to be able to accommodate everyone. If you do have insurance, that greatly helps. Please don't not bring your insurance cards. Bring your insurance cards. CVS will process the insurance claim. But anybody who doesn't have insurance or who is underinsured or has any fears that their insurance will cover a flu shot, come anyway. The town will figure out a way to make sure that it is covered. You will not be balance billed. So what else is changing on the landscape right now? As of last Friday, ice hockey and ice skating have been placed on a 2-week pause. This is a result of the state looking into a number of cluster events that were happening associated with hockey and ice skating. So they are watching clusters very carefully. There are grumblings that they're also watching other indoor sports like basketball and lacrosse that have moved indoors. Again, the air quality indoors is very different than the air quality outdoors. The ability to spread out outdoors is much more obvious in a lot of fields than when you move inside to an indoor space. We're carefully watching trends. The state is carefully watching trends. Today is the 4th day in a row that the positive test results in Massachusetts have been over 1,000. These numbers are not heading in the direction that we really want them to be heading in. And that is, as I said, people are getting comfortable. I know people are getting tired. I know people just want things to go back to normal. And I know people are anticipating that as the winter comes, we're all going to end up back indoors and in our smaller groups. And I think a lot of people may be trying to capitalize on some of these nicer weekends and these holidays and these reasons to gather. But now is not the time to take the masks off and let the guard down. Now is the time to be extra diligent. So as we go into the winter, we're not faced with 1,000 cases a day over an extended period of time. That is all I have for tonight. Does anybody have any questions?
Thank you, Kristen. I wanted to back up on one thing. I think it's important for people to understand that when you get tested, even if it's not because you're sick or you were identified as a close contact, that anytime you get tested, you need to quarantine. I think there's a lot of confusion about that. So in a school setting, in a work setting, you get COVID tested because you want to make sure you're okay because you have you wanted to visit your grandparents.
Yep, there's no requirement that anybody would quarantine under those circumstances. If I had been tested to go travel I have no reason to believe I'm positive. So there would be no reason for me to quarantine.
Only when you return from travel then, yes?
Correct. I would quarantine people who are identified as positive, are ordered into isolation. People who are identified as close contacts are, as soon as they are identified, placed in quarantine. They are encouraged to test. And if they test, no matter the results of their test, if they're positive or negative, their quarantine, their 14-day quarantine period is not impacted. For some of those other categories, anticipating that you were going to travel, anticipating that you were going to go to a family event, most people would be having that test, assuming that they would be shocked when
So
you go to get
those,
the test for the medical procedure.
those people do not have to quarantine.
No. People having medical procedures, that's on the doctor's offices. What I have heard from friends is they have gone and gotten the test, and the doctor has said, okay, we're assuming you're going to be negative. Your test, your procedure's in 2 days. Limit any chance in there for anything else to come up. But it's not a strict quarantine. It's not a government ordered quarantine. Government ordered quarantines result from identification as a close contact, travel, and symptomatic positive people.
Okay. That does clear things up a bit. Anybody else? I can't see everybody. I don't know if my view changed or it's because of the coronavirus picture.
I can stop the screen share, and
No,
that
that's
might
okay. I don't have.
allow everybody to see each other again.
Does anyone have any questions, or are there any questions in the box there?
Oh, good idea, Lynn. Thank you. Nope, there's nothing in the Q&A. I just want to suggest, as everybody, considers some of the gatherings and considers participating in, hosting and whatnot, that once this happens, it's very hard you can't unring the bell. You can't get to 50 and say, now I'm going to, it's getting too big. I'm going to let everybody go. At that point, everybody's already mixed and let their guard down and taken their masks off. And we're dealing with the potential of a super spreader. I hate to use the word super spreader, but a spreading event. Every gathering beyond your immediate household has the potential to be a spreader event. Every person walking around has the potential right now to be an asymptomatic positive person. If we all continue to conduct ourselves as if we are positive and everybody we come in contact with is positive, we keep our masks on, we keep our distance, we don't participate in high-risk activities, we can keep our numbers low. The state's numbers are creeping up. We've had 2 weeks now that we've had 9 cases per week. That's not something I want to see continue.
If somebody has concerns about something that's happening in the moment or something they hear is going to happen, what's their best course of action?
So I guess they can talk to us. Education from our standpoint is our best tool. The orders are in effect. If people have concerns, there is a number at the state. There is the ability to let us know, and we can attempt to do more education. We are doing our best. This is one of the formats that we're using. We're trying to use social media to our advantage to remind people. Obviously, we'll be having something probably go out. We will definitely be having something go out before the weekend in anticipation of Halloween. One of the interns is actually going to be looking at our website over the next couple of days and be planning for some upgrades and some, just to make it a little bit more engaging. I think, our website is fantastic, has a ton of information on it, and was born out of necessity in March. And I'm very proud that we have all that information up there. But I think it's time to look at it and try to make it a little bit more engaging. It's time to fact check it, make sure it's all up to date. And I've charged one of the interns with starting that procedure as well.
Aria or Chris, do you have anything?
No, it was a good update.
Yes.
Thank you.
All right, so if we don't have anything more, I can make a motion to adjourn the meeting at 5:31 today, October 27th.
Second.
All those in favor?
Yes.
Mills, yes.
LeBlanc, yes. Thanks, Kristen.
Thank you all.
All righty,
Thank
we'll
you.
talk to you soon.